Hi everyone, my name is Miranda Garcia, and today we are going to be talking about microbial diseases. Specifically, we are discussing diseases of the genital urinary tract, and today we will be talking about three specific diseases. The first disease that we'll talk about is the pelvic inflammatory disease, abbreviated as PID. The second will be bacterial vaginosis, abbreviated as BV. And the third will be Fournier's disease, otherwise known as Fournier's grain-ging disease. So to begin, let us discuss the female reproductive system. The female reproductive system is a complex system that plays a vital role in human reproduction. It is responsible for producing eggs, transporting them to the site of fertilization, nurturing a developing fetus, and giving birth. The female reproductive system includes both internal and external organs. The external organs include the labia majora, which are two large folds of skin that protect the other external reproductive organs, and the urethral and vaginal openings. The second is going to be the labia minora, which are two smaller folds of skins located inside the labia majora that protect the clitoris, vaginal opening, and the urethral opening. Thirdly, we have the clitoris, which is a small sensitive organ located at the front of the vulva and is responsible for sexual pleasure. And fourth, we have the vaginal opening. And again, that is all demonstrated on the diagram to the right here. The internal organs of the female reproductive system include the vagina, which is a muscular elastic canal that extends from the cervix to the external genitalia. It serves as a site for sexual intercourse, birth canal, and the passage for menstrual flow. Second, we have the uterus. The uterus is a pear-shaped muscular organ where a fertilized egg implants and develops into a fetus. Thirdly, we have the cervix, which allows fluids to pass between the uterus and the vagina, and also is responsible for enabling the baby to travel through your vagina as well during childbirth. And fourthly, we have the fallopian tubes. These are two tubes that extend from the uterus to the ovaries, which serve as a site of fertilization. And lastly, we have the ovaries. The ovaries are two small almond-shaped organs located on either side of the uterus, which produce and release eggs into the fallopian tubes. They also are responsible for producing estrogen and progesterone, which are hormones essential for pregnancy and other reproductive processes such as menstruation. The female reproductive system is regulated by a complex of interplay of hormones and is responsible for a variety of physiological processes. So, now that we know a little bit more about the female reproductive system, let us move on to the first disease that we will be talking about today. The first disease is known as pelvic inflammatory disease, or will be abbreviated in this presentation as PID. So just a little background about PID. PID is a bacterial infection of the internal female reproductive organs, so the uterus, fallopian tubes, and ovaries more specifically. This infection occurs when bacteria from the vagina or cervix travel up into the uterus or the other reproductive organs. The infection can also cause inflammation and can spread from the reproductive organs all the way into the lower parts of the genital tract. So, some causative agents of the PID. PID is usually caused by sexually transmitted infections, otherwise known as STIs, such as chlamydia or gonorrhea, but it can also be caused by other bacteria found in the vagina as well. Women who have multiple sexual partners, a history of STIs, and previous PID infections are at higher risk for developing PID. And the major risk factors in general for PID would be sexual intercourse with multiple partners, having sexual intercourse without a condom or protection of any sort, intrauterine device implantations such as IUDs, douching on a regular basis, tubal ligation, previous history of PID, and even particular age. Next, let's talk about the disease mechanisms of PID. Once the bacterial infection reaches the female genital area and becomes infected, inflammatory response or damage occurs, which could lead to potential scarring, adhesions, which will cause the chronic pain of pelvis, or blockage of the fallopian tubes in general. This chronic inflammation of the fallopian tubes and the lining can lead to the loss of ciliated epithelial cells, which can impair the ovum transport from the fallopian tube into the uterus, which could increase the risk of infertility and ectopic pregnancy altogether. So some patient symptoms of the pelvic inflammatory disease would include lower abdominal pain or swelling, potential fever due to the inflammation and the infection, abnormal vaginal discharge or bleeding, painful intercourse, irregular menstrual bleeding, or genital tract tenderness. So how PID is typically diagnosed primarily through clinical examination through a healthcare professional. Also, laboratory tests can be done. A common laboratory test that is done is the nucleic acid test, or otherwise known as NAAT, and it is used to detect DNA of bacteria, specifically chlamydia, from samples of bodily fluids from the cervix, vagina, eyes, rectum, or throat and urine. Also, an ultrasound or a CT could be done to help reveal evidence of PID, but does not necessarily conclude a diagnosis of PID, but it definitely will show if there is inflammation taking place with any of the female reproductive internal organs. In this next slide, we take a closer look at the epidemiology of PID. PID seems to be more prevalent in women between the ages of 15 and 25. This is most likely due to sexual activity with multiple partners. And while the incidence of PID has decreased over the past decade, it remains a frequent occurrence in both outpatient clinics and emergency departments. Sexual education can prevent PID by providing information about sexually transmitted infections, STIs, and their mode of transmission. When individuals have a better understanding of how STIs are spread, they are more likely to take precautions such as using condoms during sexual activities and getting tested regularly. Also, sexual education can promote open communication about sexual health between partners, which can help prevent the spread of STIs and reduce the likelihood of developing PID. By promoting healthy sexual behaviors and encouraging individuals to seek medical attention when necessary, sexual education can play an important role in preventing PID and overall sexual health. Also, individuals who recognize the symptoms of STIs, including chlamydia and gonorrhea, which are the most common causes of PID, can help decrease the occurrence of PID as well. Treatment for PID typically involves antibiotics to target the primary pathogens that are causing the infection. So that would be for gonorrhea and for chlamydia. These typical antibiotics that are used are ceftolozane, ceftriaxone, clindamycin, or doxycycline. If PID is not treated in a timely manner, the infection can cause complications to arise, such as ectopic pregnancy, infertility, chronic pelvic pain, or even an ovarian abscess. More so, the effects of fertility can be substantial, where some studies indicated a 5-fold increase in infertility among women with a history of PID. The likelihood of infertility related to PID is higher if chlamydia is the cause of infection. Therefore, seeking immediate therapy or treatment with antibiotics is essential. The next disease that we are going to be discussing is going to be bacterial vaginosis, otherwise known as BV. So, bacterial vaginosis is a common vaginal infection caused by an overgrowth or imbalance of the natural bacteria in the vagina. Typically, lactobacilli, which is known as the good bacteria or natural bacteria, it is an aerobic bacteria, is outnumbered by anaerobic bacteria or bad bacteria, pathogenic bacteria. If too much of the anaerobic bacteria is present, they disrupt the natural balance of the microorganisms within the vagina, which leads to the bacterial vaginosis and inflammation and infection. On this next slide, we are evaluating the causative agent of BV. And BV is not typically considered a sexually transmitted infection or STI, but sexual activity can increase the risk of developing BV. And it's typically more common in women of reproductive age. Certain behaviors or risk factors that affect or cause BV would be unprotected sexual activity or frequent douching. By taking a closer look at the disease mechanisms, normally lactobacilli dominates the vaginal environment, which is responsible for maintaining an acidic pH that inhibits the growth of pathogenic bacteria. In BV, the pH of the vagina becomes more alkaline due to the overgrowth of the anaerobic bacteria, such as Gardnerella vagitalis, Prevnotella, Mobilumcus, Mycoplasma hominis. These bacteria produce enzymes and toxins that damage the vaginal epithelium, disrupt the vaginal microflora, and interfere with the normal immune response. Some common signs or symptoms of bacterial vaginosis include thin gray, white, or green discharge from the vagina, a fishy odor of that discharge, vaginal itching, or burning during urination. Bacterial vaginosis is typically diagnosed through a combination of a physical exam and laboratory tests. During the physical exam, a healthcare provider will examine the vagina for any signs of inflammation, discharge, or odor. They may also perform a pelvic exam to check for any abnormalities. Laboratory tests can include a sample of vaginal discharge, which is examined under a microscope to look for the presence of certain bacteria associated with BV, so whether that be the aerobic or anaerobic bacteria present. Additionally, a pH test may be performed to check the acidity of the vagina, since BV can cause a decrease in pH. Now let's dive into the epidemiology of bacterial vaginosis. BV is a very common vaginal infection. According to the Center of Disease Control and Prevention, or CDC, BV is the most common vaginal infection in women aged 15 through 44 years old. It is often asymptomatic. 84% of women diagnosed with BV do not experience any noticeable symptoms, and 18.8% of women have not engaged in vaginal, oral, or anal sexual activity. Pregnant women are also at risk for developing BV, with rates as high as 25%. Also, the likelihood of developing BV increases with the lifetime number of sexual partners. Also, non-white women have a higher prevalence of BV. 51% of African American women are at risk for developing BV. 32% of Mexican American women are at risk, and 23% of white women are at risk. The treatment for bacterial vaginosis typically involves antibiotics to restore the balance of the bacteria in the vagina. The specific antibiotics used for treatments may vary depending on the severity of the infection, individual health factors, and other factors. But the more commonly prescribed antibiotics for BV include metronidazole and clindamycin. Both can be taken orally or applied topically to the vagina in the form of cream, gel, or a suppository. Treatment for the infection usually lasts 7 to 14 days, depending on the severity. And it is important to note that while antibiotics can effectively treat BV, they can also disrupt the natural balance of the bacteria in the vagina, which can lead to other infections, such as a yeast infection. Some women may benefit from taking probiotics or making dietary changes to support a healthy vaginal microbiome. Although BV may resolve on its own, seeking treatment is recommended to reduce the risk of serious health complications associated with the condition. These include an increased risk of transmitting or acquiring HIV, delivering a premature baby if BV is present during pregnancy, and contracting other sexually transmitted infections such as chlamydia or gonorrhea. These STIs can lead to pelvic inflammation disease, PID, which can again negatively impact fertility. The last and final disease that we will be discussing today is Fournier's disease, otherwise known as Fournier's gangrene. Fournier's disease was first discovered or identified by French physician Jean-Alfred Fournier in 1883. Fournier specialized in the study of venereal diseases and identified this particular disease as an idiopathic form of gangrene that is characterized by tissue dying or necroticizing due to the lack of blood flow or bacterial infection, and is a flesh-eating disease that destroys tissues such as soft tissues, arteries, muscles, and nerves. This disease typically affects the genital and perineal regions of the body, but if not treated, it can spread to other places of the body, such as the thighs, stomach, chest, causing more muscle, nerve, and artery damage. This is also a potentially life-threatening disease if not treated effectively or in a timely manner. Fournier's disease is caused by a bacterial infection of either aerobic or anaerobic bacteria. Typical aerobic bacteria that causes this infection is E. coli, Klebsiella, Proteus, Staphylococcus, and Streptococcus. The anaerobic bacteria that is typically involved in this bacterial infection are Bacteroides, Clostridium, Peptostreptococcus. These bacteria either enter the genital or rectal areas through various means such as an abscess, anal fistula, genital piercing, bladder or urinary infection, sexual intercourse, ulcer, or a previous injury. There are several factors that can increase the risk of developing Fournier's gangrene disease, which include obesity, diabetes, alcoholism, drug abuse, an individual who is immunocompromised, medical conditions such as cancer or liver kidney disease, previous procedures or trauma in the genital or rectal region, or catheterization. Looking further into the disease mechanisms of Fournier's disease, we could see that the bacteria responsible for the infection releases toxins that destroy the surrounding tissues, causing necrosis or death of the affected area. The infection typically spreads rapidly through fascial planes, which are thin layers of connective tissue that surround and separate different muscle groups. The bacteria can quickly reach deep tissues, including the muscle, nerves, and blood vessels, leading to the tissue destruction or necrosis, sepsis, or potentially life-threatening complications. The toxins produced by the bacteria also trigger an inflammatory response, leading to the formation of pus and gas within the affected tissue. This can cause swelling, redness, and intense pain in the affected area. As the infection progresses, the skin in the affected area may also become discolored. It could become blistered or ulcerated, and the surrounding tissue may feel hard as well. Typical patient symptoms for Fournier disease include pain or discomfort, swelling or redness, pus and unpleasant odor discharge from the affected area. The skin may appear blue or black, which indicates that necrosis is taking place or the sign of tissue death. The skin appears shiny or tight. The patient may feel fever or chills. They may also have signs of nausea, vomiting, or diarrhea, or they will also have difficulty urinating or passing stool. Diagnosis for Fournier disease typically involves a physical examination, medical history, and laboratory tests. The healthcare provider will examine the affected area, looking for signs of redness, swelling, or pus that may also be present. They also may take a tissue sample for laboratory analysis. The laboratory tests may include blood tests to check for signs of infection, such as an elevated white blood cell count, and to evaluate kidney and liver function. A wound culture may also be taken from the affected area to identify the bacteria responsible for the infection and determine the appropriate antibiotics needed for treatment. Imaging such as X-rays, ultrasound, and CT scans may also be performed to evaluate the extent of the tissue damage and to determine the best course of action for treatment as well. Fournier disease is typically a rare condition with an estimated incidence of 1.6 cases per 100,000 cases per year. It is more common in men than women, with men accounting for about 95% of cases. The condition mostly affects middle-aged to elderly men. Also, the mortality rate of Fournier disease is high if not diagnosed or treated early. The overall mortality rate is anywhere between 20 to 40% if not treated. Therefore, treatment is essential for improving patients' health condition. Fournier disease is a serious disease and can cause some serious complications if not treated in a timely manner. Some serious complications that may occur would be acute renal or kidney failure, acute respiratory distress syndrome, arterial occlusion or blockage, colostomy, heart failure, sexual dysfunction, stroke, urinary tract infections, ileus, which is the absence of normal muscle contractions in the intestines, or an overall decreased quality of life, which can eventually lead to clinical depression. Treatment for Fournier disease typically involves immediate hospitalization. Also, admission into the ICU or the intensive care unit may be required depending on the severity of the infection at hand. Also, in a hospital setting, close monitoring and follow-up care are essential for the successful outcome of Fournier disease treatment. Also, antibiotic therapy is an essential part of treatment for Fournier disease. Broad-spectrum antibiotics are typically used to cover a wide range of bacterial species that may be involved in the infection. Antibiotic therapy should be initiated as soon as possible. Surgical debridement or intervention may also be an important part of treatment. Removal of infected or necrotic tissue to prevent the spread of the infection to any surrounding or adjacent tissues is crucial. And also, depending on how severe the case is, removal of the affected organ may be necessary. If surgical debridement or intervention takes place, then also there is a possibility of possible reconstructive surgery. Another big part of the treatment or therapy strategy for Fournier disease is going to be overall supportive care. This may include pain management, wound care, and nutritional support as well. This concludes my presentation. These are my references, and I hope you guys learned a lot. Thanks.